It was a place where I could go and find out more about how to be the best dentist and best partner for my patients. My name is Rachel Day, and the name of my practice is Day Oral Health. Over the years, I've evolved from sort of a jack of all trades into more of an adult treatment planning. I've always found cases with worn dentition, especially worn anterior teeth, where the bone has migrated coronally, very difficult to treat. What do we do? Where do we start? Are we looking at ortho first? Do we look at crown lengthening? And one of the things that I really enjoy about the Treatment Planning with Confidence workshop is all of these questions are answered, and we're given a method for approaching these cases so that the cases can vary, but our approach remains constant. The workshop has really revolutionized how I work with patients. I feel that it's taken the gates away. Historically, I've looked at dentistry as, well, this is where the teeth are. Maybe I can move something. Instead, I now look at the teeth from a denture setup standpoint, which was a paradigm shift for me. I use the decision trees. The decision trees have been very helpful. My treatment outcomes have changed significantly since I completed the workshop. When a patient comes in with a chief complaint, previously I would migrate to that treatment complaint. Now I'm able to take that complaint and elevate what the patient may have previously thought was possible to now what's truly possible. I absolutely love visiting the Scottsdale campus. It really is a vacation for me. Although I'm working hard the entire time I'm there, I come back rejuvenated, re-energized, and ready to go. Treatment Planning with Confidence strikes a chord in me because I think that's one of the areas where we all struggle, and knowing that we have a place to turn and gather information is absolutely fantastic.